I recognize the honourable member for Dartmouth North.
Madam Speaker, our offices hear regularly from people who are struggling to have their needs met without attachment to primary care. One told us, quote, "I live with some chronic ailments and I have no support to properly manage them. My partner is in a similar position. I have 3 children and there are many things I would like to have support with from a primary care provider," end quote. And another person said, quote, "Both of us have multiple disabilities. My spouse's health needs constant monitoring. We have no continuity of care and it is stressful," end quote. Can the Minister of Health and Wellness assure these and all 160,000 Nova Scotians on the Need a Family Practice waitlist that they will have attachment to primary caregiver?
I recognize the Honourable Minister for Health and Wellness.
Thank you, Madam Speaker. I do want to assure folks that are on the Need a Family Practice Registry that one of the most important things and options available is to update their health information. So recently, as a result, people living with chronic conditions such as diabetes actually have been attached to a clinic to support their healthcare needs. Also, they've been scanning for people who have time-limited conditions such as pregnancy to make sure that people have access to the care they need. There are a number of ways in which people can access, and it also speaks to the necessary and important step of making sure that every individual in Nova Scotia has access to their healthcare records to ensure continuity of care.
The Honourable Member for Dartmouth North.
Not sure how those two things line up, but let's go on to the next question. Another person told us, I can, quote, "I can utilize services like Maple for refills, but no one is consistent and no one is consistent. And when my mental health is worse, I don't have anyone to provide support and help change my meds if needed," end quote. Another said, quote, "My 77-year-old father has been without a family doctor for several years now and has been waiting the whole time. He's getting his prescriptions refilled via phone appointments, but has had several health issues that need a primary care doctor as a main point of contact. He's dealing with prostate cancer, high blood pressure, joint issues, and all the things that go hand in hand with getting old, all without a family doctor," end quote. Are these the people who this government thinks are managing just fine with virtual care?
I recognize the Honourable Minister for Health and Wellness.
So again, I go back to how important it is for individuals to work either through 811 or online in order to update their information. We know that there are people who do require complex care. In some cases, that can be handled through pharmacies, as an example. Cardiovascular health, there's some diabetic care that can happen through there. There's a number of different avenues. We are looking at attaching people to a family practice. A family physician is very important, but there are other primary care providers who can support people in a health home environment. So I would encourage people to make sure that their information is updated on the Need a Family Practice Registry, and also to look at other avenues in which they can get support. We are scanning that Need a Family Practice Registry on a regular basis to look for people with chronic conditions and attach them to appropriate chronic care.